Hi, this is Carl Leopson at the University of Arizona, and I'm going to spend a couple minutes talking to you about the tools that we use in identifying kids in the federal category of emotional disturbance. And we'll talk a little bit about what the entire process is and what kind of the controlling assessment tools are in actually identifying kids in the area of emotional disturbance. So I hope that by the end of this short session, you'll be able to name some of those assessment tools and remember what they are so that when you see them, you'll have some familiarity initially. So let's look at the overall process. And this is, I believe, a checklist from the identification manual in the state of Connecticut. Thank you, Connecticut, for doing a nice job of creating an identification manual that is very comprehensive. You know, this checklist is for emotional disturbance, but it has characteristics and assessment tools that are similar across identification for most federal categories of disability. So first of all, they suggest that anytime you're going to assess and try to determine whether or not a child has an emotional disturbance, there are clearly some tools directly related to emotion and behavior. You should document interventions that have been used and the student's response to those interventions. You should do some direct assessment, and we'll look at an example of what that looks like, and observational assessments. Also, psychosocial and cultural history, that's something that goes into the assessment report for any student being considered for a federal special education category. Intellectual development, or IQ testing, standardized cognitive or developmental testing. Measure of educational progress, something like the standardized achievement test, work samples, curriculum-based measures. A health assessment so that we can rule out health issues. And any other standardized assessments recommended by professionals. So you can see really that the controlling element here is because all of those other elements are common to other assessments for kids in special education. Is what's really controlling here are these assessments for emotional and behavioral issues. So let's take a look at some examples of what some of those might be. We're going to look at standardized measures, and in this case it will be the BASQUE, the Behavior Assessment for Children, version 2, and some direct observation. Let's start with the BASQUE. Now the BASQUE, it's been around for a while. It's on its second version. It is a survey, and it includes multiple forms for parent, teacher, and other informants. About 139 questions. I don't know if that's the same for each of the forms, for each informant. A lot of questions. It takes a while for somebody to answer, but it gets you a lot of data. And we're going to look at, this is only some of the data that you get, but we're going to look at some of the graphic summary of data, how it can help to identify some DSM diagnostic categories, some of the critical items that it looks at, and some of the scales and just some of the questions within the scales so that you get a sense of those. Let's take a look at this graphic summary really quickly. So for this student, let me explain the scale first. So you see on the side it says T-score, and the T-score scale that goes from 20 to 120. T-scores have a mean of 50. So if you're average, you're at 50. If you're anything above 50 is above the average. Anything below 50 is below the average. It's kind of a T-scores are kind of handy that way. It's a simple way of looking at things. You can see that this child has a really high score, is way above the average on the category of hyperactivity, on the category of general externalizing problem behaviors, the category of attention problems. And you can see that above 50, there is a dark area and a somewhat lighter area. The darkest area is kind of the clinically significant area. So if a child scores in that area, it's more likely clinically significant based on the fact that they've given the BASQUE to many kids, so that they have some norms on this. There's a whole other section to the right that shows that the BASQUE also collects data on appropriate behavior, on a child's adaptability, their use of social skills, their leadership ability. You can see this child scores very low in study skills, but just about at the norm in other skills like functional communication and overall adaptive behavior skills. This is just another way of looking at that same data. You can see, look at the scale scores summary. You can see that there's a raw score, which is the score that comes from actually scoring the items as they are designed within the test. The T-score that shows, as I said, where that child sits in a range where the mean is 50. Percentile rank, and we've talked about percentile rank before. That means the scores, for example, in hyperactivity, this child is at the 99th percentile rank. That means that 99% of kids scored the same or lower than this child. More likely lower. Let's move on to the next piece here. So this test can also assist with DSM diagnoses. For example, these items here, they've pulled out the items, and you can see we've got item 11, 39, 53, 81, 109, 114, and 137, and together those items fit within that category of generalized anxiety disorder in the DSM, or relate to that diagnosis within the DSM. They've omitted a lot of these items just because this is a sample and they don't want to show us what all the items on their test are, so that we don't steal them and go create our own test. But things like worries about things that cannot be changed, and the response was sometimes, is nervous, often. If you remember when we looked at the graphic summary, this child scored very high in categories relating to items of attention deficit hyperactivity disorder. So you would be able to look and see exactly how this child scored on each and every item. Conduct disorder. This child actually scored relatively high, it says, compared with the general population in items on the BASQUE that are related to the DSM diagnostic criteria for conduct disorder. Same for oppositional defiant disorder, which is not surprising considering that conduct disorders and oppositional defiant disorders are closely related. Critical items. These are really important. These are items that you look at and you say, oh my gosh, if a child is being scored as ever engaging in these items, then there may be a serious problem. Eats things that are not food, sees things that are not there, threatens to hurt others. I can tell you, I can guess at what some of these other omitted items are. They're things like starts fires, hurts animals, bullies peers. Okay. So having this index of critical items helps us hopefully catch things quickly that could spin out of control and that should signal us that a kid needs assistance right away. And also items by scale. So this just gives you a sense for the fact that there are scales. There are a number of different questions that go into a scale for aggression, a number of different questions that go into a scale for anxiety, for attention problems, for atypicality, learning problems, somatization, withdrawal, adaptability, functional communication. And you can also see how some of these categories relate directly to the federal criteria for identifying, those 5 federal criteria for identifying a child with an emotional disturbance. Let's jump over to direct observation now. So this is another thing that you're very likely to see when doing an assessment to identify a student with a emotional disturbance. And you may be, if you're going to be a special education teacher or some other school service provider, you may be tasked with going out and doing an observation. So these observations are based on the notion of an ABC format in behavior, that there's an antecedent, that there are conditions under which behavior occurs, there is the behavior, and there's a consequence that then leads the behavior to happen or not happen again, all right, that influences the occurrence of future behavior. And boy, I've done a lot of this. So I worked for many years as a behavioral consultant and spent many days just sitting in a classroom, scripting out antecedent behavior consequence data. And what you get with this is a really nice sense of the connections between a child's behavior and consequences. And you can look at repeated behaviors and if those repeated behaviors have similar consequences so that you can learn what to do about them. Really important piece of a functional behavioral assessment. So again, there is a process and a set of assessment tools that you use in identifying a student with emotional disturbance. Certainly there's the psychosocial and cultural history, intellectual development, educational progress, health assessment to rule out health problems, any other assessments recommended by any therapist or professional. But the controlling pieces are really the emotional and behavioral assessments. And some of those are standardized and some of those are direct observations. So now you know just a little bit more, I hope, about the assessment tools used to identify youth who qualify for the federal category of emotional disturbance.